Yat hello everyone. Welcome to Protect the Sacred's Tribal Voices from the Pandemic Town Hall. I'm Allie Young, Programs Manager at Harness and founder of Protect the Sacred. I'm going to keep this intro brief because Taboo and I get into a great conversation about the purpose of this town hall. He's unable to be with us live, so we pre-recorded our conversation, which I'll play right after I give a land acknowledgement. We'd like to begin our event with an acknowledgement that the land I stand on is home to my people, the Diné people of the Navajo Nation, the original stewards of this territory in northwestern New Mexico. We are committed to uplifting the community members from these nations who continue to reside here. We've dropped a link in the Facebook comments to help you name the ancestral lands you're tuning in from. We encourage you to save or bookmark that link to help you identify the ancestral lands you occupy. Give us a moment, we're just teeing up the video. in this very important town hall that we're putting together. I think it's really important for who've really been thrilled to hear our experience through this pandemic from the leaders who've been on the front lines, who've been protecting our communities, and who have the solutions really going forward. So when we're thinking about our experience working with the new administration and working who've been on the front lines as communities, protecting our communities and building back post-pandemic, we're thinking about the Native communities who've really been the leaders and working on the front lines model community and building back the world on how we've handled the pandemic. We're thinking about the vaccine rollout. Communities who've really been we've handled the pandemic. We're thinking in reflecting on the year that we've been through, what is unique about the Native community that contributed to the rapid response in Indian country, the rapid response to COVID? And how have you seen Native youth step up around COVID, like voter suppression and racial justice over the past year?
I think the beautiful thing is the resilience that we've had over the years, and like I said, our ancestors, the resilience, the never say die mentality, the continue pushing on, bringing the good medicine, whether it's something as simple as me planting in my backyard with my family, just so that I could carry on that idea of wanting to inspire in different ways. And I saw the youth do that as well, whether it was their activism, the fact that they spread goodwill and brought positivity and optimism to the res and different reses around the U.S. and in Canada, First Nations people, even around the world. You got to understand, I'm an international act, so I have the pulse to Indigenous people around the world as well. So whether it's my Brazilian relatives or my relatives in Australia, like I'm checking in and seeing how the youth is reacting during the pandemic and how they're responding the same way that our youth are responding, in Indian country. So, I'm taking a book of the chapter of resilience and wanting to still educate myself and not acting like I know everything about it, because I'm still learning myself. I'm getting all these crash courses of life and educating myself and wanting to learn more and not claiming to know everything. But what I do know is that I learned a lot about the way that the youth have come together to build that wall of optimism for the future. And when you have kids and like-minded youth that want to just be able to be the front runners and be in the trenches and be those people that are in the front lines, just like how we had the water protectors in the front lines, the youth, they set the tone for us as we all came together at Standing Rock. It's the same mentality, and that's something that I appreciated when I went to Standing Rock and I saw the youth standing there and being there for months in advance, even before everyone got there, to know the story of the youth and their resilience and their passion and their love for the mission that they were on. Like, for me as a 45-year-old man, like I salute that mentality, and I just want my kids to have that same approach to life.
Yes. Yeah, I'm always inspired by our Indigenous youth. They're so creative and so talented, and they're the leaders, and that's why we're investing in them.
Yeah, even like just recently with the run at Standing Rock, like they were running in the snow, and for me, I looked at that like, man, whatever I can do to be able to amplify what was going on there, because that moment in my life, it flipped my whole script as far as like what my purpose was. Before that, you gotta understand, Ellie, and I'm being 100% honest with you, I didn't understand my purpose. I just knew my job. My job was to entertain and to sing and to perform, but there was no higher purpose. And then when I went through my battle with cancer, then I started understanding that this is part of my healing process, was to go to Standing Rock, to go to Washington Native Nations March, to go to be part of Indigenous Peoples Day in LA, and actually activate the idea of just being part of this amazing explosion of inspiration that I get from my relatives and from allies that I could learn from. And that was the moment of clarity for me, to understand the power of the youth. Because living in a household where I have my own children, I only know that, right? But when you step out and you see young folks really being active and making a difference and using their voices to stand up against injustice and inequality and racism and imperialism and all the things that the youth are very active in, like, that inspires me, and it makes me want to continue being part of the solution.
My next question is, what's your message to folks who haven't been vaccinated? We're talking about doing this for our communities and for our relatives.
I don't like to pass judgment on anyone. I like to lead with love. I would be a hypocrite if I was like hating or being negative, bringing negative frequencies on those that may have a difference of opinion or choice. I'm the guy that said, where's the love, right? So I want to lead with love, but I also want to be mindful and empathetic to those that may need some guidance, especially folks that may be at the fence, like, oh, I don't know, there's all these things that I'm hearing about online. Well, we got to protect ourselves, and we got to protect our elders and protect our families and our relatives. And it starts with us, and if we can be an example, and even if I'm championing the idea of vaccination and someone in my crew is not, that doesn't make us different, or that doesn't make us like going to go against each other or anything. It's still love. But, I advocate for vaccination. I know that there's a lot of misconceptions and there's a lot of things that's pumped out there, but, we just got to take care of ourselves. And honestly, as a cancer survivor, I'm speaking from the heart, ladies and gentlemen. I battled the craziest beast on the planet. And, it was I'm getting choked up thinking about it, because my June 24th was my 7th year of being cancer free. But when I was dealing with that horrible disease, all I could think about was, Creator, please give me one more chance. Creator, please don't take me out. I will do better. I will, whatever I got to do better, to be a better version of myself. And so that's all it is. My message is simple. Take care of each other. You're not alone. We're all in this together. And, even if we disagree on it, I'm still going to love you. I'm still going to lead with love, and I'll still be as candid and transparent as possible and let you guys know that it's all love. But just take care of each other.
I love that. Thank you. Thank you for sharing.
I get emotional, Ellie. That's a topic that's very triggering for me, because I know that we have a lot of brothers and sisters and aunties and uncles and grandfathers and grandmothers that are going through the same battle that I went through, and the same horrible disease that I faced. And now I'm trying to use my platform to be an advocate in the fight against cancer, especially in Indigenous communities.
Yes. Yeah. And I think it's also something that translates over to what we're seeing in our communities right now because of COVID. We've lost so many family members that I'm sure when they were on ventilators were asking for that second chance as well. And for me, it's always about, especially our elders who we're still learning so much from.
I'm a grandma's boy. She was the matriarch of my family. And so, when I think about COVID and I think about the elders getting sick and even our youth, and it just, we have to use our voices. And if this is a conversation that needs to be had, I'm glad that you're putting on this town hall so that we can have allies and relatives come and speak from their testimony and give actual testimony on how we can do better and how we can help. Because that's really what it is. That's why you're doing this town hall, is we're bringing all these like-minded relatives and allies to be able to speak and to give their testimony, just to be of service and to help. And if one person is affected, next thing you know, you have another person that's affected by inspiration. Next thing you know, we have 1 million people inspired. So that's the message.
That's awesome. Thank you for the work that you do, Taboo.
Thank you.
So inspired by you, and and happy early birthday.
Oh, yes, Ellie, yes. Yeah. I'm so happy that I got to share this with you, and just to celebrate life and my friendship with you. I spent some time with you in New Mexico, and it was pretty awesome to learn about your background, but also to know that when our time permits and there's opportunities like this, I'm going to be there for you, sis, and I got your back.
Yeah, thank you. And you left us with a couple of performances, so that's what we're going to lead into next. So
awesome.
Thank you so much.
Yeah, so can I tee it up?
Yeah.
So I was blessed to work with this group called the Mag 7, MC1, Dreezus, Doc and Spence, Superman, PJ Vegas from Redbone, and this beautiful MC named My Verse, Taino sister. And I also got to have amazing relatives like Shailene Joseph, Bethany Yellowtail, Martin Sensmeyer, Kahara Hodges was on this record, Lehigh. We were all part of this video. Even our ally, Shailene Woodley, participated. So it was just a contribution to Standing Rock and all the water protectors. So the first video was called Stand Up, Standing Rock, No Dapple. And then the second video is my favorite song, Black Eyed Peas, Where's the Love? Stand up with the First Nations and the people that been living here for thousands of years. Stand up. We've been fighting for freedom since the Nina and the Pinta and the Santa Maria. Stand up. Like Geronimo, Sitting Bull, Red Cloud, Crazy Horse, Leonard Patier. Stand up. Now they're poisoning our water for our sons and our daughters, so we on the frontier. We one nation, one cause, one people, one tribe. Now it's us against the pipeline. Get on your feet for Standing Rock, and we'll show you how strong we could be when we unify. To all my native people, recognize the keep your head up. To all my tribal people, recognize Where's the love?
Change. New days are strange. Is the world insane? If love and peace are so strong, why are there pieces of love that don't belong? Nations dropping bombs, chemical gases filling lungs of little ones with ongoing suffering as the youth die young. So ask yourself, is the loving really gone? So I can ask myself, really what is going wrong in this world that we living in? People keep on giving in, making wrong decisions, only visions of them dividends, not respecting each other, denying thy brother. A war's going on, but the reason's undercover. The truth is kept secret, it's swept under the rug. If you never know truth, then you never know love. Where's the love, y'all? Come on. Where's the truth, y'all? Come on. Where's the love, y'all?
People killing, people dying, children hurting and crying. Can you practice what you preach and would you turn the other cheek? Father, 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 help us, send some guidance from above. These people got me questioning, where is the love? 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 One res, that's all we got. One res, one world, that's all we got. One res, that's all we got. One res, that's all we got.
Oh, that was so amazing. We thank you again, Brother Tab, for taking the time to lend your voice to this event. Today's his birthday, so let's show him some love in the comments. Now we're going to turn to the live conversations, and I'll start by inviting our first panelist to turn on your videos, and I'll introduce each of you as you do that. We're joined for this first panel, tribal leaders and health experts, by the president of the Navajo Nation, Jonathan Nez. Also the president of the Oglala Sioux tribe, Kevin Killer. He was recently elected this past pandemic in 2020. Dr. Loretta Christensen, who is the Chief Medical Officer of the Indian Health Services Navajo area. Dr. Jill Jim, who's an epidemiologist and executive director of the Navajo Department of Health and member of the Biden-Harris COVID-19 task force, and entrepreneur and CEO of ZapCare, a healthcare company being piloted in the Navajo Nation, Mark Atlin. Welcome. Hi, everyone.
Hey.
President Nez, are you there?
Yes, I'm here, Ali. Good afternoon.
Okay, so I'm excited to get into this conversation. I actually have questions for each of you, so I'll just kind of go down the line. And the themes of this first panel is really about, how we've built trust in the COVID vaccine, tribal sovereignty, fighting for resources, and building relationships with allies. So the first question goes to President Killer. What role has tribal sovereignty played in the success of the vaccine rollout?
Thank you, Ellie. It's good to see you, and happy birthday, Taboo. That's really cool. Thanks for referencing that. I'll do a traditional greeting. Hamdakiapi maka ikilia hime chante washte nape jusapilo. I shake your hand with a warm and good heart. My Lakota name is Close to Earth, and English name is Kevin Killer. I'm sending a land acknowledgement from the Lenape territory out in Pennsylvania. We were out here today with Secretary Holland and doing some work around repatriation of boarding school children and stuff like that. So it was a good thing. But to get to your question, Ellie, I think one of the biggest things, especially around, of how did tribal sovereignty help us in the vaccine rollout. When I first came into office, as you mentioned earlier, like campaigning during COVID, all this kind of stuff, you had to be super cautious, and you had to take a lot of, you had to be mindful of just how you met the public, read it, all that kind of stuff. And, I previously served in the legislature for 10 years before this role I'm in now. And you're always like, okay, campaign 101, you meet people, shake your hand, all that kind of stuff, but you can't do that. And I think one of the best things that, that happened was, being able to let tribes determine their own fate in terms of, okay, the communities know best on how to handle these kind of situations. And really, here's the resources to do that, and really leaving it up to our own tribe to do that. And we have our amazing team led by Dr. Alicia Musso, who is our vice president, and she took the initiative to really kind of gather all the resources, kind of transition from where we were pandemic and pre-vaccine to, okay, well, here's a vaccine, here's how we can implement it, and we made sure that we prioritized people who are going to get that. And I think that's one of the best things that came out from this new administration, was saying that it was kind of a spinoff from the previous administration, but to this administration is like, you can prioritize who you want to get the vaccine. And I think that's like one of the biggest things, is just ensuring that we were able to prioritize our healers, our traditional medicine people, our language speakers, who are mostly elders, and just making sure that they had a place in line, and that way it would really vouch and make sure that was safe for other people, and they role model that, and really just making sure that we were able to kind of do that. And when that happened, I think it kind of led to like a trust, because there's always been this historical this historical mistrust of vaccines and how the IHS and how they were deployed. But allowing us to actually determine who gets those, what's that relationship, and seeing that, okay, this is for the health of your community, really helped us be able to establish a foothold on that. And I think that's, President Nez could probably kind of help elaborate on that too, but that's kind of what really helped, is just being able to determine our own fate, and how do we battle with this, how do we deal with this, and how do we do it in a good way and be responsible, how do we work with all our community partners, who are all enrolled tribal members, because we all have a stake in this, and I think that was like one of the best things that we were able to do. So thank you.
Yeah, thank you, Kevin. My next question is for Dr. Jill Jim. What do you see as the main barriers to full vaccination, what we refer to as herd immunity? Some of the barriers to vaccination are long-standing challenges rooted in a healthy distrust of the government and a historic legacy of research abuse in Native communities. So, how can we rebuild trust in Native communities? How are we already doing that? And yeah.
Yeah, thanks, Ali, for that question. I am Dr. Jill Jim, and I am of the Reed People clan and born for the Red Street Running into Water clan, and originally from Navajo Mountain, Utah, and a current cabinet member for President Nez under the Navajo Nation. So just thanking you for this opportunity, and all the leaders out there that have been fighting COVID during this entire time. And that's a really good question. A lot of the barriers that I think when we think about vaccine pre-COVID is probably different to some extent, slightly different, but I think what we're challenged with is probably a lot of the misinformation. We have access to social media, the news, and a lot more avenues than we did probably 10 years ago. So I think constantly providing good education about vaccines and the benefits of that is very important. I think there's just the idea of just because we don't get as sick, maybe in the younger population, we don't need a vaccine, or either I already got COVID and I don't need a vaccine. So I think there needs to be just an understanding of just how the disease progresses and how you can get infected, and just the aspect of how the vaccines can benefit. So I think there's a lot of education that needs to be done, because as you mentioned, President Kevin Killer, that our elders are really important in this, and just understanding how to re-educate our young individuals, because here on Navajo and elsewhere, these are the ones that are probably maybe are the ones that are getting COVID more right now. And we really need to come together as elders and older aunts and uncles and grandpa and grandmas to just kind of give that heart tough speech to our younger population. And I know President mentions that all the time, and I think those are instilled in our teaching. So I think going back, our response to COVID isn't just from the Western aspect, but it's also from our traditional teachings and all the cultures that we are in. So I think there's a lot of value in just combating that whole misinformation. And the mistrust that we already had before, I think really related to either unapproved research or using our DNA without approval, or data without the tribal approval. And so there is a lot of real building trust that needs to happen. But I think all people really need to understand is really follow and understand tribal laws wherever you're at. Doesn't matter if you're a researcher or you're wanting to introduce a vaccine or whatever, understand what jurisdiction you're in and acknowledge that it's just not a free-for-all when you go onto the Navajo Nation and think that there's no authority to oversee whatever particular laws are in place to help protect the people that live on the land. So I think that that has been improving in years to come. And I think just wanting to thank institutions out there, federal agencies, to ensure that our rights are addressed and met. So, and as far as rebuilding trust, and I think in this administration, part of being in the advisory board, there has been opportunities. And I think there was really a 360 on when the transition happened with COVID. Now we have access to more resources, and also just the ability to get vaccines out quickly to Indian Health Service in the states for Indian country. I mean, we were on top of their list because of the detrimental impact from COVID. So, I mean, right there's already presence. And with our now at the time nominated and confirmed Deb Holland as well to kind of lead the way in how we're sort of trying to rebuild that trust with the government to government relationship that we have. But with health, it's definitely there, and I think we're going to continue to push, but I think we have more expectations that ought to be met. And I know that as a new secretary, Javier Becerra has attended some of these conversations, but we want more, because I think there's a lot of unmet needs that have not been met. So that's where we're at, Ali. There's just a lot more work, and we're trying to catch up from years of not having items addressed. So thank you.
Thank you. Yeah, absolutely. And I agree 100% with that. And I thank you for leaders like all of you who are helping to make that difference and call out for those resources. My next question is for President Nez. How has COVID impacted tribal communities, and when did you realize the threat to take immediate action? And then just a second question, with the Delta variant out there, and I know that it has reached within Navajo Nation, if you could address, how we're coping with that, how we're dealing with it, and kind of, are you implementing things that we learned with, the back in March of 2020.
Thank you, Ali. Thank you for having us on your segment. Just as we have gone through these 16 months, we have been evaluating what worked and what didn't work. For the Navajo Nation, we are at herd immunity, if you want to call it community immunity. 70% of our adult population have been fully vaccinated, and 69% of our 12 to 15-year-olds now fully vaccinated. And so, I think now as we transition slowly out of the pandemic, of course, the pandemic is still here, but I think our Navajo citizens have learned a lot. We've been doing town hall meetings as well, getting information out, having our Navajo physicians talk to our Navajo citizens, both in English and Navajo. We're still doing town hall meetings. Dr. Jim and her team have done an outstanding job with Dr. Christensen. It's all about collaboration. And we started that early on. Even before that first COVID positive case was on Navajo, we developed a Navajo Nation COVID-19 preparedness team. And we got together, we got the IHS, these federal programs together, the states, the schools, and began to discuss this when the virus was coming across the ocean to the northwestern part of the United States. And we went door to door, letting our Navajo citizens know just to, be careful. And we were surrounded by states that have COVID positive cases. And even before we even had our first case here on Navajo, we declared a public health emergency. And so I truly believe the nation, the government, the partners did their very best to get the word out. And I just applaud the Navajo people for adhering and following these very strict protocols. We had lockdowns, as you know, Ali. We had mask mandates. We still have mask mandates today. We're not ready to check those masks right now. And we just did the resolution to reopen our nation because we're confident that wearing our mask, following these protocols that CDC has started with at the onset, now they change it up again, right? There used to be 6 foot social distancing, then they go to 3 feet. We kept it at 6. Mask mandate, they told us you don't need masks. Now they're telling everybody you need masks again. But we followed through those first recommendations from our healthcare professionals. Of course, as you know, people like you, Ali, and Harness and others doing these types of town hall meetings to encourage our young people to follow our elders' teaching. And as Dr. Jim said, we use some of our resilient teaching, if you want to call it that, or hashket teaching here to make sure our young people are honoring and respecting their leaders and their public health professionals, just like we were taught when we were young, and we saw the elders, come to the forefront, utilizing our way of life teaching, teaching like the hero twins, fighting off the monsters. And today we have modern day monsters. COVID-19 is one of them. And, of course, we have issues here in our nation with health problems, just like any other Indigenous nation throughout the country. In places with people of color, we have high rates of cancer, diabetes, heart diseases, but we were able to, get the message out. Our thoughts and prayers go out to those that have lost their lives and those that are long haulers now. But the Navajo people really showed leadership, and I commend them all, and I commend all our leaders throughout Indian country. You got President Kevin Killer. We have Lori Christensen, who we loan out to the feds for a bit, being the chief medical officer in Washington, D.C. Roslyn So done an outstanding job. I think she should be the next IHS director for the whole country. And Dr. Jill Jim, with her team every day on the forefront. And I was proud to be, amongst them, shoulder to shoulder throughout this pandemic. And I think people needed to see that. Now, the people needed to see their leaders out there on the front lines throughout this pandemic to let them know that, we're resilient, we're overcomers, and we're going to be able to get through this tough time. And some leaders really did some awesome work throughout the country. And I applaud all the tribal nations for pushing back on this modern day monster called COVID-19.
Yeah, President Nez, and we thank you for your leadership and your partnership with us at Protect the Sacred and Harness as well. My next question is for Dr. Christensen. Based on your experience working with patients and studying data, what would you like the community to know about this phase of the pandemic? And has COVID changed the way you think about your work in tribal communities?
Thank you so much for having me, and thank you for the question, Ali. We are still analyzing, and we will be for some time, but there's been a lot of really key lessons learned. I'll try to condense them down to what I think is most important to convey today. First of all, I do want to just reemphasize what's been said by President. The leadership early, proactively, in preparation, readiness was very critical to being successful. We had two really severe waves of COVID, and I think they would have been much worse if we hadn't worked so hard and been so responsive. My thanks goes out to the Navajo people for their strength and resilience. My staff and all the staff at the tribal and urban sites, Navajo Nation, everybody worked together as one unified entity. And that was the biggest lesson learned. Unified message, unified effort, supporting each other, because the enemy was COVID. There was nothing else to think about other than what could we do together to save our people. And that came through over and over and over again. And I think, that was really demonstrated with our vaccine response, which was extraordinary. The teams were amazing. The collaboration was amazing. Vaccine was distributed quickly throughout the whole Navajo Nation, every corner, all the way to Flagstaff, to even give our urban site vaccines so our people would have access to them. That takes working together. That takes a common good. And that is the biggest lesson to learn, is take your teams, your external partners, and we thank them all, Cope John Hopkins, Doctors Without Borders, CORE, everybody that they were wonderful. They integrated extremely well into our culture and into our facilities. And we really thank them for everything they've done. But the message I want to give today, and I'm going to answer your Delta question, is that we're concerned. We did a great job stabilizing everything, but I want to tell the people we're not done yet, unfortunately. I'm very grateful for where we are right now, but we cannot let down, because that virus is going to keep changing to try to survive, and we have to be smarter and better and more prepared. So we do have to very much encourage, and thank you for encouraging everybody to get vaccinated. That is our best weapon. That is a tangible weapon for us against COVID. So please, 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 everybody get vaccinated. Secondly, as President said, masks. We didn't ever give up on that. And I still tell people, when you don't know where you are, if you're in a crowd, please wear your mask. Please be vigilant at all times, because you can still get COVID. You won't probably be as sick. It may not be as deadly, but you could still become ill. And we've lost enough. We don't want anyone else to be stricken with COVID. So we want to really tell people, still keep your distance, wear your masks. If you make sure that you wash your hands and all your hand hygiene and cleaning of your homes. And we're protecting ourselves, we're protecting our families, our communities, our neighbors, and our health, and our workers, our co-workers, because most of the cases we're seeing now are unvaccinated people. And then they're carrying it to people that are vaccinated who still have a small percentage that will get ill. So if we keep working, and we work high and low, our strategy is, and mine especially, is go where the people are. If they want their vaccine at home, let's go to their home. If they want it at the rodeo before they go in, we're going to give it there. We're going to have drive-throughs. We've done all of these things. We still have strike teams looking at strategies to get to everyone, because it's that important to us to continue to protect our people. And so those lessons learned are going to carry into anything we do moving forward. Finish defeating COVID, which will be done, and we can do it together, and then be prepared to keep delivering excellent healthcare, keep working together, and then develop a public health system that is prepared and ready at all times for whatever challenges. We are extremely fortunate across Navajo. We have the most wonderful individuals. We have, my epi lead Janelle did a fantastic job leading the public health response. We were lucky to have these key people that work for us in Navajo. We were just very fortunate, and they did an amazing, extraordinary job. But we want to prepare everybody. We want everybody to know this is what we're going to do should this, and I hope it doesn't, ever happen again, that we have learned all our lessons and we have applied them to moving forward and protecting our people, our future, our history. So thank you so much for the question, and thank you for having me.
Thank you, Dr. Christensen. I think that's such an important message and reminder that, as President Nez said, this is a monster, and monsters try to live on, they try to survive. So thank you for that reminder. My next question is for Mark Atlin. How has the pandemic informed your business, ZapCare? And if you could talk a little bit about it. What are your hopes for a project like this in Navajo Nation and across Indian country?
Ellie, thank you so much for having me. I appreciate this. And I just want to do a quick introduction. My name is Mark Atlin. I grew up in Gallup, New Mexico. I'm from Gallup. I'm an enrolled member of the Apache Nation. And ZapCare is a direct response to the pandemic. For most people, the pandemic represents pain, as we saw the Navajo Nation with the highest infection rate per capita. I understand the pain the nation is feeling. We lost our loved ones to this disease. I've experienced this pain personally. I lost my grandmother to COVID-19, similar to Taboo. While we fight for this equitable funding for the Indian Health Services and other federal agencies, we have to do more to be proactive rather than reactive when it comes to healthcare delivery. We refuse to let this happen to us again. There are multiple barriers for Native Americans to access healthcare, preventative care, or even accessing preventative medication at local pharmacies. ZapCare, a Native American-owned business, is committed to accelerating the means and methods for providing accessible healthcare and medical supplies distribution to fill the service gaps and really to support the Indian Health Services. The pandemic has reinforced why businesses like ZapCare are absolutely needed. Our company utilizes modern technologies and telehealth and mobile vehicles to bring preventative services to Native American schools, chapter houses, and senior centers, and enhance care further with the use of long-range drone technologies to deliver prescriptions and critical supplies directly to our patient's front door. This is a game changer in reaching those in need across a large and rural area. ZapCare is divided into 3 simple buckets. The first bucket is telehealth. We're offering virtual urgent care and patient management through a phone, tablet, or computer. We'll also have telehealth booths at local chapter houses for citizens that don't have access to internet or for those who are seeking privacy with their physician. Our second bucket is to deliver preventative medications such as insulin and critical supplies using autonomous drones. And our third and final bucket is our mobile medical fleet, a custom medical vehicle equipped with a licensed and vetted medical staff that will deploy in designated areas across the reservation to render healthcare. And at the heart of ZapCare is a simple notion: meeting communities where they are, including other tribal nations, as we look to expand our services across the country. We really are our own solution for ourselves.
Thank you, Mark. Yeah, I'm excited for ZapCare, and we're here to support as a community member, and also protect the sacred. And thank you for your innovation and for what you're bringing, and the lessons that you've learned from the pandemic and implementing that into your project.
Thank you, Ellie, for having me. I appreciate your support.
Yeah. All right, thank you. First panelists, I would like to now start introducing our second panelists. If you can turn on your cameras, I will start introducing you. First, we have Ann Lee, who is the CEO of CORE and an inspiring leader and a sister. Savannah Romero, Manager of Partnerships and Programs at Illuminative, a racial and social justice organization, enrolled member of the Eastern Shoshone Nation. Eric Garcia, Program Manager at Urban Indian Health Institute, a division of Seattle Indian Health Board, and the only one of 12 tribal epidemiology centers which serves urban Indian health programs. Ethel Branch, who is the former Attorney General of the Navajo Nation and also the Executive Director of Navajo Hopi Solidarity. Joshua Allison Burbank, faculty at Johns Hopkins Center for American Indian Health, specialized in speech language pathology and neurodevelopment, enrolled member of Navajo and Acoma Pueblo tribes. And lastly, Ben Hunt. He is a member of the Lumbee Nation or tribe of North Carolina. He is a rising 11th grader at Lumberton Senior High School. He has been a member of Teen CERT since 2020. He has participated in a 6-month food box distribution where he and other Teen CERT members distributed more than 20,000 food boxes to the local community. He has assisted in mobile vaccination clinics. And most recently, he and other Teen CERT members have been mobilized for a vaccination canvassing campaign for the next 4 months. Very impressive. Okay, so thank you all for joining me. I'm not sure if Ethel is on yet, but I'll go ahead and start with my questions. The theme of this panel, which we're calling Community, Culture, and Rapid Response, is about community response, culture as focus in public health messaging, the homegrown solutions that we've all learned and are beginning to implement in all of our work, and building trust in the COVID vaccines. So my first question is for Joshua Allison Burbank. What is unique about Native culture and community that contributed to the success of the response to COVID?
Hi, Ali. And once again, thank you for having me very quickly. She'e Joshua Allison Burbank, Yunishia, Luganishla, Kisani Bashashe, Tohana Dashache, Kisani Dashanella, Akot Ego Dene Hastinishla. Thank you again for having me. I'm joining you again from the Johns Hopkins Center for American Indian Health, the Albuquerque Hub office, which is on ancestral lands of the Rio Grande Pueblos here in Albuquerque, New Mexico. So I spent the majority of last year working as a speech language pathologist in Shiprock, New Mexico, while also working on my family's farm. Today, I'm still reflecting on these two spaces and what took place over the past year and a half. I'm still recovering as much of you are doing as well. It is in this reflection that I find the answer to, again, why we're still here, why we survived. And President Nez said this earlier, it's that concept of kinship and family connections, and it's what saved our Indigenous communities. It's what's made our response so successful in the Navajo Nation. Here's what I've seen over the past few years amongst our youth, our teenagers, and amongst our young adults. Respecting the elders, respecting our tribal leaders, and finding ways to serve them in very unique and innovative ways. Being willing to give some of what you have to others. Learning the old ways. Listening to stories, telling your own stories. Taking time for yourself to reflect, to let your brain, your body, your stories, your breath, to take time to connect to the earth. All this has been happening while respecting this time in which this great sickness passes over our lands. Last summer, I saw very early when we started to search the first time on the Navajo Nation, I saw our youth step up. This included the young boy who remained determined to learn while sitting at a computer alone all day while his father worked, or the young ones who learned to grow crops along that San Juan River. It was this group of Indigenous educators who raised money to get the net children's books into those food packages that were going across all throughout the Navajo Nation. It was also those that could not wait and organize their own mutual aid efforts in their own communities, like my friends and colleagues at the Nehotzel Relief Fund and other relief funds. Now it's the young adults who are keeping this momentum going through their activism, their food security work, and learning the Diné language and their culture. This makes me emotional as this is a resurgence, because this is true Indigenous resilience. So to answer your question of what's got us through, what brings us to today, it's that resilience piece that is hard to define, but we've seen it happen in our Native youth, and we've seen it happen as we attempt to protect those who are most sacred, the keepers of our stories, the keepers of our memories, and the keepers of our future. Thanks, Ali.
Thank you. My next question is for Anne. What have you learned about collaborating with community leaders in the work you do as an outside organization? What is the benefit and how has it informed your work at CORE?
So important for us to come in a humble manner. And I think we learned so much from working with our partners in the Navajo Nation. There's three things really that came out of it that has really led us to our work outside of Navajo Nation. So the first is leadership. President Nez and Dr. Jill Jim and the IHS system, I mean, the whole leadership component was so lacking in so many parts of the United States, but it was so there in Navajo Nation. And I think it was incredible to see that it was a marked difference from what we experienced. And for that, we were extremely grateful. Second, it was the existing social as well as the IHS and the CHR, PHN infrastructure that was there. I think when we first came on Navajo Nation, we were trying to figure out, well, you know, how do we get materials to certain groups? How do we do all of this? You know, let's just sit, meet as many people as we can, let's talk. And often, you know, I think people miss out that there's already so many strong institutions and how important it is that you have to work within those institutions and work within those social networks to strengthen them, not to, you know, compete with them, not to replace them, not to, you know, it's really kind of working within those incredible people that we met and the backbone that really allowed us to reach families. And to us, that was such a huge eye-opener. And then thirdly, one of the most important things that I think that we really learned from working with the community and with the leadership was intersectionality. When we first got to Navajo Nation, we thought, okay, we're going to do testing. It's all about testing. And, you know, a lot of the folk down there were like, we've got testing. It's not about just testing. You have to have testing and tracing. But even that's not enough. You have to do testing, tracing, but also ensure that folks who are at home can actually quarantine safely. So do they have food? Do they have mental health services? Do they have hygiene kits to be able to, you know, and PPE? It was so much more of an eye-opening experience of you cannot just think about it in just one way, in one sector. It informed the way that we worked everywhere. Because of that, we're so grateful. And just, you know, having our eyes open to that, you know, we ended up supporting the testing, the tracing, the food, the hygiene kits, as well as quarantine temporary shelters. And we've brought that same methodology to the favelas in Brazil, where we're providing food, cash transfers, you know, testing, vaccines, because the intersectionality of how we need to support a community, you know, affected communities, affected people aren't going to be thinking, okay, I just need this one thing and everything's going to be fine. It's going to be, you know, how do we get ourselves out of this situation? You need so many different things at the same time. And that responsibility should be on us, not on somebody who's trying to figure out on a day-to-day basis, not only how to combat COVID, but also struggling to even keep food on the table for their kids. So I think for us, we learned so much. And for that, you know, our work with our partners, with you guys, with all the incredible people that we've met and that we're so grateful to, you know, that work is now being translated into India right now and into Brazil and even Haiti, where we've been for 10 years. So I just want to say ahihe.
Thank you, Kehet, and that's amazing. My next question is for Savannah and Eric. You guys are working on a joint campaign. Can you tell us about For the Love of Our People and what inspired and motivated you to launch this campaign?
Yeah, I can lead off. I think something that we realized early on in the pandemic that really spurred our action is that Native people were largely not being included in conversations around COVID-19 and the effects of the pandemic. And when our issues aren't being seen, that means that solutions don't get sent to those communities, right? And so what we did early on is we worked to make sure that that mainstream media was understanding and that those stories of how not only how COVID-19 was affecting Native communities, but also the innovation and the resilience and the ways in which Native communities were being creative in their responses and exercising their sovereignty in the way that they combated the pandemic. And so what we found is that communication and really data-informed messaging and strategic communication was essential, was going to be essential as we were thinking about combating this really huge nut to crack, right? And we're still working on understanding what kinds of messages resonate with people and what kinds of information people really need to mobilize to take action. So I think I'll let Eric speak to it more, speak to the partnership more, but I think that our partnership was really from a need of needing to understand what data and information is going to be useful in informing the messages that really resonate with our communities.
Great, thank you, Savannah, and thank you, Ali, for having us here. And so I think the best way to describe it too is like really thinking about all the different elements that all of our panelists have been saying. So collaboration, innovation, even Taboo saying, we have to lead with love, right? And so the Urban Indian Health Institute, as a travel epidemiology center, we're accountable for our urban relatives, right? And so our mission is to decolonize data for Indigenous people, by Indigenous people. And for us, what that means is that we need to be able to collaborate in a way that we can able to disseminate information that we find. So one of the findings that we found, and there's a lot of things that we've kind of discussed, is that the Indian Health Services and all sorts of tribal-based organizations that are funded by the federal government is severely underfunded, right? And part of this is because there's no data, there's the lack of data on race and ethnicity. And so we published a report back in February on called Data Genocide, a report card on the different states and how a lot of the states weren't reporting data on race and ethnicity. So how are we supposed to fund BIPOC communities, specifically our relatives, without that data? And so with that and the work we've done with Illuminative, we've been able to partner, figure out what sort of messages we should promote, being able to activate partnerships with Ali, for example, and really try to hone in about what are the needs, how we can best collaborate, and how can we lead with love. And so that's in a nutshell really what our For the Love of Our People campaign is. We're moving into a phase 2, focusing more on community organizers, recognizing that a lot of the work has to be done within the community, and also focusing on what we all said about youth. So that's I'll yield the floor to Ali, but thank you again for the time.
Thank you both. I think that's so important. I mean, we're talking about Indian Health Service and how underfunded and under-resourced it's been, but I think even beyond that is our thinking about our urban health institutes and the fact that, I think over 70% of our Native population lives outside of reservations. And so we really need to be, in my opinion, our relationship with the government needs to include and think about our urban relatives and think about that funding that should be going to those institutes as well. And next is my question. I think I saw Ethel come on. My question is for Ethel. Or maybe she dropped off. Okay, I think she dropped off again. I will go to Ben. What has been the role of youth leadership and what motivates you to protect your community?
Thank you, Ms. Ali, for the opportunity to speak. First of all, I'd like to say I'm a student at Lumberton Senior High School. I'm also enrolled as a member of the Lumbee Tribe of North Carolina, serving both the Robinson County CERT team and the tribal CERT team that we have here. So CORE does lead our CERT program, but our local community leader is, it's led by a local Indigenous community leader. She should be on here today. Her name is Miss Linda Maynard Oxendine. And she leads us, through organizing what we do and, how we deploy, during a time of disaster. One thing that I would like to say is that the way we do it is, we want to prepare our community for future disaster. All right. That's kind of the whole goal that we have to achieve, here, because our community is so vulnerable. And I do think our role is to, obviously it's just to protect and serve our community. And one thing that I do want to talk about is our, food distribution that you didn't mention. Our role during that was to hand out food boxes and also organize this in such a way that both parties passing and receiving these food boxes, were kept safe, i.e. wearing masks and such as that. We couldn't physically go into the person's car. Maybe they had to get out or whatever. And, this brings up a point to where, the youth, like me, we recognize these things. And, I think we have to accredit that, to our leaders. Simply because, they're the ones that have, led us here. They've trained us, and now it's our time to go out to the community and, do the work there. And as youth leaders, obviously, we want to be able to have a sense of, a sense of pride within ourselves, in order to do this, because it takes a lot. I would say it takes a lot of courage in order to, step up to the plate during a time of crisis like this, is that we were thrust into in order to go out and, prepare people for a disaster, which COVID was a disaster that did hit us pretty hard in Robinson County. And, us taking the training and us being prepared for that really did help us when it was time to go out and deploy to our community and say, hey, this is what we're doing. And, we're offering these services. Come by and let us help. We also, as youth leaders, have to stay prepared ourselves. One thing is, if we aren't prepared ourselves, there's no way we can go out and prepare our community. We have to stay prepared in order to accomplish a task in a disaster such as this. This disaster was very, very, it hit close to home, simply because this community, I grew up in it my whole life. And simply staying prepared for it allowed me to just go out, no emotion, and make things happen. And I also do think, what motivates me to protect my community is how vulnerable my community is to certain disasters, such as hurricanes, or even like this now, a pandemic that we're in. We really have to strive, for, again, to be prepared. And that's kind of the whole thing that I wanted to talk about today, is just preparedness in general for, our younger age groups, and also our adults. Everybody has to be prepared, and everybody has to be, on the same playing field so we can accomplish the task.
Absolutely. Thank you, Ben. Wow, I'm so inspired by your leadership. Thank you for the work that you do. And yeah, I think we'll all be in a better place if we follow Ben's lead. My last question is for Ethel. I'm going to unmute you. Ethel, are you able to unmute on your end? There you go. Thank you for joining us.
You can hear me?
Yeah, I can hear you. So my question for you is that, You played a huge role in organizing mutual aid across Navajo and Hopi. What void were you filling in terms of the broken infrastructure that exists in many of our tribal communities and the lack of funding and resources?
Yeah, I guess my first point is that in Indian country, it's not so much an issue of broken infrastructure. It's a total lack of investment in Indian country to begin with. We don't have the same starting block as every other community. Tribal governments don't have the same infrastructure resources that non-tribal governments have at their disposal. So I guess I would really just say that there's a lot of work that needs to be done to make that initial investment in infrastructure in Indian country to ensure that there's parity for tribal people and tribal governments. I mean, all of this country is Indigenous land. Every Native American should be a millionaire, and Indian country should be very well resourced. Tribal governments should have all of the funds that they need to operate effectively and provide for the full array of needs of their people. So, I think that's an initial point. And then in terms of, what inspired me to act quickly, in addition to just knowing there's this total absence of infrastructure and this huge equity gap in Indian country, was knowing the high prevalence of underlying conditions in our communities. This has to do with Indian country being a national sacrifice area for the last century. On Navajo, we have a story of uranium with over 523 abandoned uranium mine sites and the largest nuclear waste disaster in the United States taking place on our lands and contaminating our watershed. This has led to high rates of cancer in our community. The number one cause of death for Native American women is cancer, and it's the second leading cause of death for Native men based on CDC's 2017 data. We also have very high rates of diabetes in our communities, and that's being traced back to radiation exposure. And so, just the legacy of contamination has left a huge challenge in place for Native communities, and that needs to be cleaned up with all due speed. And then, of course, in terms of infrastructure and the needed investment, we need piped water in our homes. A third of our communities at Navajo and Hopi don't have piped water in their homes. The Navajo Water Project identifies Navajo people as being 67 times more likely to be without running water than others in the United States. This created a huge barrier to our people in terms of having easy hand washing opportunities, which we know is critical in preventing the spread of COVID. And then in terms of electricity, we were providing massive food relief in our communities, but we were struggling with the fact that a third of the homes in our communities didn't have electricity. And so without electricity, that meant that it was really difficult for families to isolate and avoid risk of exposure and having to go into towns many times off reservation. Over half of Navajo shoppers purchase their groceries off reservation. There are only 13 grocery stores on the entire Navajo Nation, which is the combined size of Vermont, New Hampshire, and Massachusetts. I mean, there's this huge, extreme food desert conditions in our community. And when people are driving, they're driving on average 4 hours round trip to purchase their food, which means that they probably have to stop along the way. They have to get gas, which has increased the potential exposure. So these were the things that inspired our team to act, because it was like, okay, honestly, I felt like our communities were sitting ducks for COVID. It was like the perfect conditions for COVID to wreak complete havoc in our communities. And that's why, I stepped away from my law practice with the best Indian law firm in the country to make sure that our communities were safe, because I did not want to see the high adverse outcomes in our communities, and that has borne out. I live in Coconino County in Arizona, where a quarter of the population is Native, yet we account for 3/4 of the deaths from COVID in this county. So yeah, I think it's all about a need to invest in cleanup of contaminated spaces in Indian country, so that Native people have an equal opportunity to have healthy families and happy families. And then also there needs to be a massive investment well beyond what has been proposed so far in terms of creating parity for Indian country, in terms of basic governmental infrastructure so that our public safety system can quickly and adequately respond. I would say there were many people who died on Navajo and Hopi who didn't have to if we had the same ratio of paved to dirt roads on our territories, and if we had a fully operational two-way radio system so EMS could have seamless communication when ambulance were responding to households. And if we had addresses like locations for homes so ambulances could find those homes quickly.
Yes. Oh, wow.
Thank you, Ali.
Yes. Yeah. Thank you, Ethel. That was so informative. And I think the exact message I hope reaches wide and far. And I hope that, even the current administration has an opportunity to hear these conversations. And, I think that's our goal for this town hall, is to say that, we need more investment, and we need to be at the table as well when we're talking about building back tribal communities post-pandemic, when we're talking about what are the solutions, and we have them right here. And all of you have been amazing leaders, and I thank you all for joining, and I thank the public for listening in on these important conversations. I'm excited to lastly introduce Eugene Tapaha and his girls, who lead the Jingle Dress project, to close us out with a dance. Eugene, I invite you to share a little bit about your project and what inspired you to create the Jingle Dress project. So you can turn on. There you are. Hi.
Hi. Hello.
Yeah, I can hear you.
Okay, perfect. My name is Erin Tapahi. Yate she Erin Tapahi and she Kiani and she Tachi Bashishi Tabahe Dashishi Sodashi Dashinella.
Hi, my name is Deanna Tapahi, Kiani Nishle Tachini Bashishin Tabahe Dashiche Torchini Dashinala. Yate Sunny Brigade Dishe Patani Nishle Tachini Bashishin Tabashini Dashiche Hansala Dashinala. So we are so happy to be a part of this event today, and we are obviously, you can see that we are traveling. We are currently in Seattle, Washington, and we are currently in a parking garage because we have been going around throughout the city trying to get photographs and doing other events. So we're grateful that we were able to make this fit into our schedule, and that we were able to hear the other leaders and the different panelists before us, and we thank you for letting us be a part of this event. So Erin is just going to give a quick info about our project that we've been doing and the dance that we'll be sharing.
Yes. So we're Art Hills, the Jingle Dress Project. This is a project that came because of COVID. We just because of all seeing everything back home and all that was going on when the pandemic first happened, we were social distancing and self-isolating ourselves, and we felt like we couldn't do very much. And so my dad, he had a dream of a bunch of jingle dress dancers and bison in the middle of Yellowstone. And because of the pandemic and it just not being safe, he knew that that part of the dream wasn't actually going to be possible. So he asked me and my sister, and then also asked Sunny Begay and her sister Joannie Begay to be a part of the project. So we have traveled all across the nation. We've been to the West Coast, and then now we're here in the Pacific North, and then we've been into the East Coast, and we were in New York and DC area, and all the way between. And so we've been traveling to different parts of the land to bring healing to it, because as we bring healing to our mother, we will also be bringing healing to ourselves as human beings as well. And so it's been an incredible journey to be a part of this project, and we're so happy to be here with you all.
Yes. And then we're going to also have Sunny Begay, she's going to talk a little bit about the issues that we have been, sorry, there's planes. Some of the issues that we have been supporting and the different, basically the issues that we've been doing. Hi, everyone. So as part of our projects, when we first started out last year, it was really important to us to make sure that we advocate for different types of issues that are going on in Indian country. And so as part of our regalia, we have these scarves, and on the scarves, there is a representation of a Native woman in her jingle dress, and she's it represents missing and murdered Indigenous women. We talked a little bit, I think I heard somebody talk a little bit about it before. And there's different types of things as well, like Not Your Mascot and different issues. And we thought it was really important that as having a platform and being able to dance for healing, that we were able to dance for these types of issues as well. And the reason why we started out the project was because of COVID. The Navajo Nation was disproportionately affected by COVID, and we felt like we couldn't help or do anything to like physically help or to bring relief to anybody. So we knew that our prayers through the dance and would find healing. And so, I mean, after this past year, I think we've been able to see those blessings, and it's really nice to see everybody come together and to be able to find healing in all of this. So just a little bit more about the Jingle Dance. So it is originally done by the Ojibwe tribe, specifically the Mille Lacs band of Ojibwe. And we were actually able to go out to Minnesota, which is where their homelands are, in one of our first trips last summer. And it was really fun to be able to go out because we were able to be welcomed by a lot of the elders and a lot of jingle dress dancers out there. And even though we are Diné Navajo, we felt that that this dance that we are doing is a dance of healing. And so for all of us dancers, even Joanne, who's not currently with us right now, she's in Texas, but we felt that it was a way that we were able to show representation and to be able to help our communities in some way or another. And this project, it started out as one photo shoot in the Salt Flats in Utah, but then it grew into this huge project that we've been doing for the past year. And it's been really amazing to go to all the places that we have been and to meet all the people that we have met. And it's been amazing to be welcomed by so many different tribes and different communities, and to be able to share this healing dance with you guys and with different people throughout the land. And so this dance, we actually shared a video with Ali earlier, but the song in it is done by one of our family friends, Brian Jansen, and it is a prayer song that he's done specifically for us to dance, and we hope you enjoy the video.
Bye.